Uh, Hello and welcome to today's webinar of the GC webinar series, The Aftermath of COVID-19, the New Social Impact Ecosystem. This is a webinar series we started back in April with the aim of discussing concepts that are currently not mainstream and may and perhaps should become mainstream in the aftermath of COVID-19. Today we have a great speaker, Alnoor Ebrahim, and he's going to talk about a very interesting topic, measuring social impact. Alnoor Ebrahim is a professor of management at the Fletcher School of Law and Diplomacy at the Tisch College of Civic Life at Tufts University. His research addresses several core dilemmas of social change facing businesses, nonprofit organizations, and public agencies. How should they measure and improve their impact on society? How should they handle competing demands for accountability from diverse stakeholders? How can they influence systems problems such as global poverty that require collective action? I highly recommend that you check his book, Measuring Social Change. It's really a great book if you're interested in the topic. Now, here is the plan of the webinar. I will pass it to Alnoor, and he's going to talk for 25 to 30 minutes. And then after that, we will have a Q&A. Now, in the Q&A, you can write your question in the chat box, and we might see. I mean, if we get, we might let people who are asking questions to actually ask them themselves, to unmute and ask them themselves. And we'll wrap up at 8 o'clock as usual. So without much ado, Alnoor.
Wonderful. Thank you very much. A very special thank you to Professor Ali Alni and AU Cairo, the Gerhard Center, for this invitation. Really very delighted to be with you all for this conversation for the next hour. I'm going to share a couple of slides, but before I do that, let me say a little bit about the motivation for this work. And I'll say it to you in the form of an anecdote, a story. About 25 years ago, when I was in graduate school, I spent a fair bit of time working with NGOs in India, looking at understanding their challenges of performance, their relationships with funding organizations. And a particularly memorable conversation I had with a senior executive at a large rural development NGO in India. This NGO had received a large tranche of funding from the European Commission. So it was bilateral aid that normally would have gone to government, but in this instance, actually went to a pair of NGOs. It was the first allocation of bilateral aid directly to the NGO sector in rural development in India at the time. So it was a big thing. I visited these organizations about 3 years into an 8-year grant that they had received. And I was looking at their measurement systems. They had these remarkable databases. They were tracking, their progress in irrigation, in agricultural development, in reforestation, in a series of spreadsheets. They were reporting this every 6 months back to the European Commission. So it was 3 years in, so almost halfway through the 8-year grant. And I remember this conversation I had with the senior manager. He was the deputy to the CEO at the time. And I said to him, "This is amazing, all of the data that you are collecting. How are you using it?" And his response was very frank. He said, "Alnoor, I hope we'll use it someday. But for now, it's been like a bloody cricket match." Now, for those of you that know the game cricket, you know that the game is a long one. A short match will be a day, but these can run for days. And the score, I mean, you can't count on your two hands. You really need a lot of numbers to count it. His argument was that they were so caught up in doing the work and in reporting on the work that they hadn't been able to give much thought to how could the data they were collecting help inform decision-making. So they were collecting the data for external consumption and eventually for end of project evaluation. but not necessarily for strategic decision-making along the way. And that's the core problem that this book that I've written, Measuring Social Change, tries to address. So it's written for managers of social change organizations. It's written for funders of social change organizations. And it's less about what should you measure at the end of an intervention, but more about how should you think strategically about what to measure along the way so that you can use it for your own learning and for your own internal decision-making. And this question has come up to me again and again. I teach in multiple executive programs for nonprofit and NGO leaders. And this question of what should we measure, but how can we use it, being at the essence of this. The core issue, as I see it, is a strategic one. The other thing that I want to say before I launch into the slide part of the presentation is many of you, when you signed up for this presentation, you posted questions in your registration for me. And some of the questions are around the pandemic, obviously, around COVID-19, asking the question of, how do we think about measurement when we're essentially in emergency response mode? We're trying to respond, keeping our organizations running, serving our communities, and have had to change in some respects what we do. Others are asking, how can we use measurement post-COVID for much longer term thinking? Both of these questions are about strategy. They're about your short-term strategy in immediately responding to COVID, and they're about your long-term strategy in terms of how can this position you for the long-term work that you are committed to addressing. So I'm going to talk about strategic challenges and how we might frame the strategy of our organizations in order to then align measurement with that. So let me share the slide deck. Give me just a second. Okay, so you should be able to see that now. And this is the cover of the book with Stanford University Press, came out last year and will be out in Spanish translation within the next month as well. This is a photograph of a philosopher named Alnoor O'Neill. She's at the University of Cambridge in the UK. And nearly 2 decades ago, she gave a series of lectures on BBC Radio called A Question of Trust. And much of what she said when I read her lectures, and you can actually still listen to them online, I think is very relevant to the aid industry. It's relevant to NGOs and civil society groups. It's relevant to any social change organization. She was asking the question, how do we have trust in organizations for social change work? How do we have trust in government? And is the pressures for accountability, is it enabling that trust, or is it actually undermining that trust? I'm going to put up a quote. Just one quote from her book that captures part of the argument. And let me read it for you briefly. She says that we will need to give up childish fantasies that we can have total guarantees of others' performance. We will need to free professionals and the public service to serve the public. We will need to work towards more intelligent forms of accountability. What she's arguing, or what she's suggesting, is that the demands for accountability, for demonstrating results, actually has a dark side. If we get so focused on complying with the metrics, the risk is that we might lose sight of what we were trying to achieve. She uses the examples of, in education, that we get so focused on accountability in terms of standardized tests that we forget about the broader objectives of learning and the spirit of learning and the spirit of critical inquiry. She suggests that even in the medical profession, that doctors are so immersed in filling out forms about patient health that they lose sight of actually one of their most important activities, which is spending time talking to the patient so that the patient might actually be amenable to different strategies for their care. Or even with policing, that policemen and policewomen spend so much time filling out reports, compliance reports, to protect their own backs, or recording sessions, that they forget to actually spend time building relationships with communities to build trust in order to make their presence and their policing more welcome and more effective. That's the dark side of accountability. And she's asking, can we work towards more intelligent forms of accountability that actually enable and support and encourage high-performing social change work, rather than treating it as a compliance-oriented action? So if we think about measurement as a strategic choice, an enabling choice, rather than something that we have to do for reporting and compliance purposes, it can actually fundamentally shift how we actually deploy measurement in our organizations. So that's the kind of intelligent accountability that I want to lay out for you now. So I'm going to talk about the relationship between measurement and strategy. So let me give you a definition of strategy. This builds on the business strategy literature that I've slightly adopted. But so that we're all on the same page, a simple, straightforward definition. Strategy is how an organization seeks to achieve long-term performance. Long-term is really the operative term here, because one needs to build towards that and keep your eye on that ball of long-term change. So the role of measurement is actually to support the design and execution of strategy. It's not about necessarily just evaluating performance at the end. It's about design and execution of strategies. So it needs to be done along the way. It's improvement over time. So that's how I view the role of measurement. In order to have a strategic approach to performance measurement and management, I think there's three foundational questions that any social change organization or leader needs to ask. And I'm going to walk you through those three questions. And then this will lead us to four types of strategies that I will lay out for you. The organizers of this seminar have already emailed out to you a 2-page handout, which is a summary of the key ideas of these three foundational questions and four strategies. So you don't need to worry so much about taking notes. You'll have that summary handout for you in your inboxes as a takeaway from this. So let's start with the three foundational questions. I hope the questions will seem obvious to you, but the answers turn out to be more complicated. The first question is, what do we seek to achieve? Right? This is the existential question. And the German philosopher Friedrich Nietzsche is attributed as having said that the most common form of human stupidity is forgetting what we were trying to accomplish. We get so caught up in the day-to-day of execution, of me doing my research or my teaching, or of an organization executing its health support work or its child education work, that we lose sight of the big picture. What is it that we're actually after? And how do we actually track progress on that? In the language of strategy, this is your value proposition. It's similar to your mission, but it's much more specific. It requires you to explicitly articulate what are the needs that you're trying to address, and for which client or beneficiary or customer groups are you trying to deliver on those needs. If you can get a sense for that and the scale of that challenge, then you will know how far along you are on that. That's the first question. The natural question which follows is, so how will we bring about that change through our social change organizations? And in the language of strategy, this is your social change model. This is different from your business model. Your business model is how you raise the revenue, the money to actually do this work. But this is the core work, the social change model. And there's a whole set of tools and methodologies available for this that I won't have the time to go into any detail. But theories of change, many of you are familiar with that. Logic models, I'll spend 1 or 2 minutes on that. And understanding the larger system within which our work is positioned. All of these are elements of the social change model. Let me also say that on my faculty website, and we'll send out the link to that as well, I've got an appendix of resources, and this appendix is in the book as well. But you can download an electronic copy of this resource list that actually lays out some of these tools and useful web resources that you can access for them. So this is the social change model, which then leads to the final question, the third question, which is, how will we hold our feet to the fire for actually delivering on this social change model? This is the question of accountability. And there we need to be very specific in terms of what do we want to be accountable for, and to whom do we want to be primarily accountable? And you can see that those two questions, for what and to whom, are actually very similar to the questions in the value proposition about what needs and which clients. So this is a virtuous circle of sorts that are foundational to strategy. Any manager of any social change organization needs clear answers to these questions. In my research, I found that even in small organizations of, say, 5 or 10 people, if you ask these 3 questions, in an organization of 10 people, you will get at least 5 different answers. And so even within the organization, people are often not aligned around what is it that they're trying to achieve, how are they trying to deliver on that, and what should they be accountable for and to whom. And so internally, only if there is alignment will there be consistent and coherent progress towards delivering on that strategy. Now, even if you have clarity and coherence within your organization around these 3 questions, there's going to be some challenges around what you should measure. And this is where the logic model, which I've just expanded on this slide, turns out to be both helpful but also constraining. So let me turn to that. For many of you, this will be familiar. This was developed actually in the 1960s. So this is not my work, it's been around a long time. The basic idea of measuring the performance of any social intervention is that you would think about what are you putting into it? Money, know-how, human capital, technical expertise. What does that mean then in terms of the activities that you actually do? So in an academic institution like mine or like Ali's, it's webinars like this, it's the courses to the students. For an ambulance service, it's the response to an emergency. Those are the activities. That then leads to a series of results. Outputs are short-term results. We can measure what a student's grades are at the end of a semester, what a patient's health condition is after it's received treatment, sort of emergency treatment in the ambulance or at the hospital, and so on. These are short-term results. And then we can think of the long-term outcomes, either for the individual, right? At the individual outcomes, long-term results, or at the societal level. Are we seeing an improvement in health outcomes for a community? Are we seeing a decline in the reproduction rate of the coronavirus within a district or a country? These are the long-term social outcomes that we can track. So this is quite ubiquitous in the social sector. Aid agencies, a lot of NGOs, a lot of government agencies use logic models. If you're a manager, though, there's a problem. And the problem is captured by this green box. Everything to the left of that dotted line, you have control over within your organization. Everything to the right of that dotted line occurs in the environment, in society. You have decreasing control over it. And so you can accurately measure your inputs, your activities, and your short-term results. It's these longer-term results that actually turn out to be much less under your control. And so this raises that perplexing question, what is it that you should measure? The general normative conversation has been, especially from the funding community, has been that you should measure long-term outcomes on individuals and society. My research asked the question, well, does that always make sense? Are there certain circumstances under which actually it might be okay to measure short-term outputs? And are there certain circumstances under which long-term outcomes for society are actually really essential to measure? And what are those conditions? These are questions of strategy. They're questions of contingency. You can't be all things to all people. You have to be focused on measuring what's relevant to your strategy. And so I'm going to give you a way of thinking about that now. The short answer is what to measure depends on your strategy, but any social change strategy is contingent on two factors that I want to spend some time talking about. The first is uncertainty about cause and effect, and the second is the control that you exercise over long-term outcomes. This will become much more clear when I illustrate it with examples in just a moment, so bear with me. These two contingencies of uncertainty and control lead to four types of archetypal strategies, and I'm going to lay out those four types of strategies for you. And so what you measure depends on which of those four strategies you choose to pursue. The fact that strategy is a choice means that you actually do need to pick. You can't do all strategies at once. You might have different units in your organization doing different strategies, but you can't do all of them at once. So let me give you four illustrations of the four types of strategies. Here's an ambulance service based out of India. It's one of the largest private providers of ambulance services in India. It was started by a former student of mine, though I can't take credit for it because he started the ambulance service with his colleagues before he was my student. But we've been in touch, and I write a whole chapter on the book on this ambulance service. If you're an ambulance service, should you be accountable in measuring long-term health outcomes of the patients you pick up? Ask this to any ambulance service manager, and they will say that would be crazy. It would be a misuse of scarce resources. What could they be accountable for? They can be accountable for the quality of service they provide to the patient en route to hospital. And they can be accountable for how quickly they respond and then deliver you to hospital. So God forbid, if I had a cardiac arrest right now, and my wife is downstairs, she would hear me falling on the floor, she would run up, she would call the emergency ambulance service number, and they would respond. We know that if ambulance services respond within 9 to 12 minutes of a cardiac event, my chances of survival go up substantially. But the ambulance service is not going to measure my survival. They're going to measure their response time and the quality of care delivered along the way. Those are short-term output measures. But we have some confidence that they're connected to an outcome. But it would be unsustainable, unreasonable for them to measure the long-term outcomes. They're just going to hand me off to the hospital, which is the next chain in the service of healthcare provision. And so they're going to measure a short-term result. Let me give you another example. Here's a rural development organization, also in India, but it can be anywhere. It can be anywhere in sub-Saharan Africa, in Asia, in Latin America. And here's an organization that provides multiple services. Right? So they will provide agricultural credit and seeds to farmers. They will provide farmer-based trainings for new kinds of crops. They'll provide support for irrigation. They'll provide access to markets and information about crop prices in different markets. You can think of these as an integrated series of interventions, a series of niches that are connected together. That is an integrated kind of a strategy, very different from the ambulance service, which just drops me off to the next sequence in the chain. These guys are actually filling out the entire chain. So they're going to measure not only what they do at each stage, the short-term outputs, but also the long-term outcomes, which is household incomes. What about this? This is a protest march fighting for the rights of waste pickers, rubbish collectors, the poorest of the poor who collect plastic and other materials off the streets all over major cities around the world. And then they try and sell this to businesses who might recycle those products. These are among the weakest members of our society, among those that are actually suffering the most during the COVID crisis. These are informal sector workers. How do we actually measure progress on their livelihoods? An organization that I look at actually works to organize these kinds of individuals and networks of these kinds of individuals. And they advocate for policies, governmental policies for supporting them. So policy advocacy work is very different from the two types of activities that I just described to you, the ambulance service or the agricultural work. In policy advocacy work, we don't really understand how cause and effect works. Or a strategy used today might not work 2 years down the road because the policymakers have changed and the policy environment has changed. So they require a different kind of strategy. And I'll come back to them in a moment. The final picture here is of an organization that works with homeless populations in Washington, D.C., the capital of the US, which has a huge per capita homeless population. These guys not only serve meals, and you can see the kitchen, the dining area in the background here. They also work with about 100 other organizations just in the DC area to actually coordinate their work so that those that are providing meal services, there's also others providing shelter, others providing mental health and substance abuse counseling, that there's an integrated way of actually a coordinated way of providing services to the homeless and getting them out of homelessness. A very different approach from all of these others, because these guys serve as a community backbone, orchestrating the work of all of these others. We can label these 4 strategies. The ambulance service is a highly focused niche strategy. So in a large ecosystem of healthcare, they've got one niche, they do it with high quality control. The agricultural service one lines up a series of niches: agricultural credit, farmer training, irrigation, access to markets. That's an integrated strategy. The advocacy organization needs to constantly adapt its strategy. So it does this and then iterates and iterates and iterates, keeping its eye on the ball of improving policies for informal workers in this case. But it needs to constantly adapt. That's an emergent strategy. The homeless serving organization that is orchestrating the work of 100 other organizations has an ecosystem strategy. It's actually trying to realign the different organizations in this ecosystem. So let me take 5 minutes before we open it up to give you a more abstract representation of this. So bear with me here. This is a 2x2 matrix. The horizontal axis is control. So down here is control over outcomes. How much control do you as a manager in an organization have over long-term outcomes? So low or high. The vertical axis is uncertainty about cause and effect. How good an understanding do you have of the cause-effect chain? That if you do this, that it will then lead to these expected results. If we understand how cause and effect works, it's low uncertainty. If we really don't have a very good understanding of how cause and effect works, it's high uncertainty. The orange arrow that you see in front of you is the activities of the ambulance service. It has a neat strategy. It delivers people to the hospital, high response time. That orange circle is the output. They measure response time and quality of care during delivery. All they can reasonably measure is short-term outputs. What you see now, the sequence of arrows, is what the agricultural organization does, right? The agricultural credit, the irrigation, the access to markets. Each arrow is an activity. You can measure the outputs, which is the orange circles, for each activity, but in the end, they add up to a larger, wider circle. This is outcomes. This is increase in household incomes or reduced migration to the cities in search of work. You can think of education systems in this way. Those of you that have been through kindergarten, elementary school, middle school, high school, university, into reasonably paying jobs, you've gone through an integrated strategy. Separate niches that add up to an outcome. So here you can actually measure both outputs and outcomes. In an emergent strategy, notice the uncertainty is high about cause and effect. We're not really sure what's going to work in order to influence public policy. So the organization tries one thing, it doesn't work, it tries again, and it keeps going until it gets to some set of results in terms of policy change that it's looking for. This is an emergent strategy. it can't necessarily claim that what it did led to those policy outcomes. So these are interim outcomes that it can claim credit for, or some kind of influence. And then finally, there's that homelessness organization that is trying to coordinate the work of all of these other organizations that provide meals, shelter, substance abuse counseling, job training. You can measure the outputs for each of these, but ultimately they lead to outcomes for the individuals, which is ending or getting out of homelessness. There are other kinds of work that fall into this arena. Much of our global negotiations around climate change, for example, are trying to orchestrate this kind of work. So this is an ecosystem strategy. The key takeaway here is that what you measure, outputs per outcomes, influence, or outcomes to society, depend on your strategy. It's a strategic choice. So strategy is a choice. Each strategy requires a distinct internal system of performance and accountability. And I devote a chapter to each of these 4 types of strategies and the type of accountability and performance systems you'd need to build in your organization for each of these. It's possible to be high performing in any of those 4 quadrants, right? If you choose a niche strategy, that's no better or worse than an ecosystem strategy. It's just the strategy you've chosen for the work that you think is important. So let me stop there. Let's open it up for questions. And here's a link to the resource appendix that I have on my webpage that will actually give you a whole list of methods and tools that you can deploy. Thank you.
Thank you, Alnoor. Guys, if you have a question, please send it through the chat box. This is very informative. I actually, let me give you an example of training in a corporate setting. When you train, for example, laborers on a production line, I know exactly what to measure, and I know exactly the impact. They're going to improve their productivity. The productivity is going to result in more production, and it has a direct profit impact. Now, this is not the same when I talk about training of middle management. And the problem with training of middle management is that the reason I'm training them is that they create options for the corporation going forward. So it's very interesting when I see it in your perspective. So the first one is pretty much like a niche strategy, I'm assuming. The second one is pretty much a situation where, because of the options, so there is a very high uncertainty of the outcome, right? Is that a correct statement?
Yeah, so that's a great analogy, actually. And I agree with you that the first example sounds very much like a niche strategy. You're very clear about the kinds of outputs. So you would measure sort of worker productivity based on sort of a series of short-term output measures, right? Okay. The quality of a certain part that they're manufacturing, or a line of code that they're working on, and so on. The middle managers, I can think of sort of there would be both a low uncertainty aspect where, if they're responsible for overseeing an entire production process, they actually have an overview of a series of niches and can actually see if that leads to a high quality product or service at the end. Right? So a team leader, a team manager that's overseeing a whole series of people, even in a consulting firm, right, that's doing work for a client, the team leader is responsible for seeing that the different parts of work that the different consultants are doing actually adds up to a whole that is greater than the sum of the parts. So that person can actually see whether the outcome is being delivered, something that the client actually desires. What you're getting at, in addition to that, for training middle managers, is when they need to innovate and come up with new ideas due to changing circumstances. There's a new competition, or the environment has changed completely, which for almost every business in the COVID environment, everything has changed. And so they need to retool, rethink what they're going to be doing. And so there you're training managers to be able to respond to uncertainty, to actually iterate on their challenges. Every academic institution that's using online learning like this has been adapting very quickly and trying to figure out what's working. And certainly nobody's going to go back to education in the same way once COVID is over, inshallah. And so that is very much both an integrated strategy and potentially, I think, an emergent one as well.
Interesting. Again, let's talk about the education. Lots of people perceive education, philanthropy, or doing work in education as a way out of the poverty trap. Now, major issue. I mean, you find people going to underprivileged area, and they work, for example, in improving the some of the basic skills of the underprivileged kids there. Now, the major problem is that the gap still remains between those community and the others. So even though I'm doing some work, the gap does not vanish. And I think it's a measurement issue because you're measuring, for example, how comprehension has improved in reading, math skills, etc., of an individual in an absolute way. Well, when you talk really about competing in a job market, it's really not about this. It's about the gap between this group and the average or the top. And when you talk to people working in this area, nobody measures the gap. And I just wanted to get your, I mean, is it if you measure it, would that help in it might change completely the way you strategy. I mean, it might take it from a niche market, a niche strategy, into more of an ecosystem kind of a strategy.
Yeah.
Was I clear in what I was trying to say?
So, well, let me try answering. And you can tell me if I've understood.
Okay.
Let me take it in a couple of parts. So the first is, the first part of this, a lot of education, I do think, currently operates with a niche strategy. I once gave a similar presentation to this one to a group of organizations that work on education, particularly early childhood. And by and large, they said to me that our strategy is a niche strategy. We work with children that are 3, 4, 5 years old. And at the end of that, we can measure some basic literacy. We can measure some basic social interaction skills, right? So that you can, for example, you can measure quite reliably how well a child understands instructions and follows those instructions. So if I say to a 3-year-old, as she comes in the door, and it's a cold day, she's wearing her coat, I can say to her, take off your jacket and put it on that hook on that wall. And if the child takes off the jacket and puts the coat on that hook on the wall, I've actually tested her understanding of those instructions and ability to follow those instructions. And that's actually a very robust test of the child's ability to comprehend and to follow. These are short-term measures. But what a lot of the early childhood education folks have argued and have demonstrated through long-term studies is that actually there's critical learning that occurs at ages 3, 4, and 5 that has a long-term bearing on their ability to succeed through the schooling system that then may have real bearing on their livelihoods and their productivity within society, their functioning within society in the long run. So we do need that longer-term kind of work. But the organization that's focused on the early childhood work is going to be focused on a niche strategy. Where I think this becomes more complicated is when we get to a stage where we're training students for skills that will serve them in the job market, right? So not just functioning in society and communicating, but actual skills development for the job market. So this is true for high schools, it's secondary schools, it's true for universities, it's true for vocational institutions. And this is where universities are getting a lot of pushback right now because it used to be the case in a country like the US where college education was pretty much guaranteed to increase your income very substantially. That gap is beginning to narrow. So lots of our students at various universities are no longer getting well-paying jobs coming out of college. And so the value proposition of college is coming increasingly into question. So the NEET strategy of educating those kids at a college or graduate school level in preparation for the job market maybe is not as valid as it used to be because the environment has changed, the nature of the jobs has changed, and we haven't necessarily adapted as well. So it requires us both to take new stock of what the environment looks like to adapt our NEET strategies, but in addition, perhaps to work more closely with industry, with secondary schools and other universities that may be feeding students to us, and the needs of communities. This would be an ecosystem strategy to then figure out how we adapt what we're doing. And I think a lot of higher education is facing that predicament right now. And unless we can figure out what the ecosystem demands, we're going to have a very hard time staying relevant. So I agree with you. We're kind of moving into that domain right now.
Super. I'm going to allow some of the people who've asked questions. I have a question from Danielle Moore. So Danielle, please unmute and start your video and ask your question.
Hi, this is Danielle Moya. How are you?
Good, thank you.
Awesome. So my question was, what measurement tools should you suggest for an emergent strategy? Would it be individual interviews, focus groups, qualitative or quantitative questionnaires? And I think that it's important and it's difficult to decide this in terms of time constraints, skills of the staff that would be involved in this. So how do you choose what kind of tool you'd like to use to measure the impact of that and then make sure that you can adjust your strategy or adjust your approach to kind of get the outcomes that you want?
Yes, very good and difficult question. I'm gonna share a slide, this let me give me just a moment. Here we go. Okay. Don't worry about all of the text on here. I'm going to ask you to focus on these contribution-based methods in the bottom right corner of this screen. This table is in chapter 7 of my book, and there's also a version of it in the resource document that you can get free through that link that I put in the chat. When we think about measurement tools, I break it down into 4 stages: performance measurement by investment decision stage. We normally think about measurement as occurring as evaluation, right? What was achieved? There's a series of stages that precede that. There's a whole kind of improving performance stage, and there's a whole series of work that occurs even before we begin the activity. So that's kind of background to what I'm about to say now. But when we are looking at evaluating an emergent strategy, a lot of folks tend to look at methods that actually are not terribly helpful for emergent strategies. So randomized control trials, experimental evaluations where you have a before and an after, or a control group and an experimental group, are not very helpful for emergent strategies, say in policy advocacy work, because we don't have a counterfactual. We don't have a control group. And so the question becomes, how do we actually assess progress in an emergent strategy? So there's a whole bunch of tools emerging in the general category of contribution-based methods. And one of them is called outcome harvesting. And so there's a link to this in that resource appendix, but even if you were to just Google outcome harvesting, it'll take you to the work that's been done on it. There's a whole toolkit around it. The basic idea is not a complicated one, but it requires a lot of patience in executing. The basic idea is that, let's say that you're a policy organization, you've been trying to advocate for a certain kind of healthcare policy. You've been seeing progress in certain circles in the policy environment and not in others. It would require you and your team to actually try and hypothesize, to lay out what are the pathways to achieving that kind of change? Where have there been setbacks? And where have you retooled and made progress? What are the different lines of approaches that you're taking to improving that policy work? And so those are your hypotheses. Those are your if-then statements. And every arrow in that sequence is a hypothesis. It then also requires you to ask the question, what might have been alternative pathways to achieving that change? So you've changed the mind of a key policymaking body or a key legislator, or you've changed public opinion on something, or you think you have. What might have been other forces that contributed towards that? So you try and articulate those as well. And then you look at that entire mapping of causal chains and you ask yourself, what gives us confidence that this led to that change and not this? So you're implicitly asking about a counterfactual. What might have been an alternative explanation for this result. And if you find that actually there's a particular pathway that seems to be the most plausible explanation, then you can, with some confidence, say that you think that this result was a product of that particular pathway, and then you would try it out in other policy advocacy work that you're doing. The outcome harvesting model actually helps you articulate that. In my book, I look at the example of an organization called WeGo, which stands for Women in Informal Employment, Globalizing and Organizing. And I actually map out, using an outcome harvesting study that they had done, their efforts to influence policy in the International Labor Organization for policy on informal workers. And they're able with some confidence to say that some of these changes were a result, not just of WeGo's work, but their partnership with dozens of organizations advocating for a similar thing. It's called contribution rather than attribution because the people at WeGo would never say it was because of us that this result was achieved. And in fact, I asked one of the founders of WeGo, why would you never say that? And she said, there's two reasons we'd never say it. One is because it was the result of a whole bunch of different players getting together to move the needle on this policy. So we would never claim that credit for ourselves. And even if we felt like we had a strong role, we would never say it because it would undermine our relationships with our partners. And so we would only claim contribution, we would never claim attribution, because part of this is to actually do this as a collective. So there's a whole series of methods. I've listed some of them here, and there's more being developed. And so the research journals like Evaluation are beginning to publish work on new and more sophisticated approaches to doing contribution-based methods.
Okay, we have two more questions. There is a question from Benjamin. Benjamin Jedran, please ask your question. Hello, Benjamin.
Yes.
Could you ask your question, please? Ask your question, please.
Yes, you hear me?
Yes.
Do you hear me? Yes?
Yes.
Okay. You started your presentation with quoting a philosopher on the issue of trust. Can you relate this issue to the different strategies discussed?
Yes, thank you. Beautiful question. The question of trust for social change organizations it's a two-edged sword in a sense. On one side, many are in the predicament that unless they can claim credit for what they're doing, it's harder to get funding, right? So you want to be able to go to your funders and say, look, here's the results that we delivered. This was because of us. And so that's why you should give us more money. On the other hand, the risk there is that there's a temptation to overclaim what you are trying to do, overclaim your credit taking for it. And that in the long run can undermine trust. Trust not only from your funders, but from the communities that you work with. And so there, I think, there's two challenges. One is, I think it's incumbent on social change organizations to be very clear about, Here's what we aim to achieve and how. This is our strategy. And as a result, this is what our strategy allows us to measure and claim credit for. And that's as far as we're going to go. At the same time, it's necessary to educate funders on this issue. In my conversations with funders, as well as with nonprofits that have pushed back on funder demands, I've generally found that funders are willing to listen. They're willing to be educated on why one would only take credit for things that you feel confident about, that are related to your strategy. And so I think it's worth taking the risk because it enables trust to build both in your relationship with funders as well as in your relationship with communities. If you overclaim and you get caught, it's going to be very difficult to recover that trust.
Thank you. Okay. We have a question from Khalid. Khalid, please unmute yourself.
Good afternoon. You hear me?
Yes.
Hello? Yes. Okay. I have a question related sometime, especially in non-profit organization, we have a measurement as a marketing tool or fundraising tool, just for reporting, as you mentioned, and so on. And sometimes we need a measurement or impact report just for 1 year or for one time. How we can, how we can use it, this report as a first step for building a system for the measurement? Because now I'm working with a consulting management company for non-profit organization, and I have a challenge, especially in this type of a project, not stable in the same logic and in the same value chain. So we need to build a measurement process, but we cannot build a system for the measurement and tracking the data on different stage of the project. How we can, the question, we can build a measurement report just for one time, or any measurement process we need to progress in the different stage?
Yeah, so this is, I think, a very critical question that is relevant for any organization. And it goes back to those three foundational questions of strategy that I posed early in the presentation. Right, the question of what do we seek to achieve, our value proposition? What are we trying, how are we bringing about that change, which is our social change model? And how will we hold our feet to the fire, the question of accountability? If you and your team, Khalid, can answer those three questions in a way that your entire team feels confident are the right answers to those questions, that will give you your basic metrics. And then if a funder for a one-time report asks you to measure things, you will be able to compare what they're asking for to what you and your team have identified as being essential to your strategy. And you'll be able to say, look, we can provide you with what's essential to our strategy, but this additional thing that you're asking is not in our strategy and in fact is not relevant to what we're trying to do. It just helps you stay focused on your measurement so that you're not spending or wasting resources on measuring things that are not useful to you. If I can share sort of a brief anecdote here, back to that original example I gave of this agricultural organization in India that was developing all of these metrics for their funders and were not using them. I went back to that organization almost 25 years later, and there's a chapter in the book devoted to them, sort of 25 years later. They no longer had the European Commission funding because it was over. And they now had 40 or more individual corporate donors. And each corporate donor was asking for different things in terms of their measurement. So now they were completely overwhelmed because they were getting all of these demands for different kinds of metrics from different corporate foundations and weren't sure how to respond. What was interesting was this fascinating and really quite inspiring perspective from the chief operating officer. He basically said, and I'm paraphrasing now, that these demands have forced the organization, have forced them to turn inward, to look inwards and to ask, what is it that's important for us to measure in order to deliver the results that we care about for our communities? Can we use that moment to clarify what are the most important metrics for delivering our work and for improving our work? And then use that as a basis for responding to funder demands for measurement and setting boundaries and saying, this is what we're going to measure. This is what we're not going to measure. If you want that stuff measured, you have to pay for somebody to actually come and measure this work, because otherwise it's a distraction from our mission and we assume you're funding us because of our mission. So it turned out to be a very empowering moment, but it's tough because you want the money and you're afraid to push back. But unless you push back, you're going to be distracted. And so that turns out to be essentially a test of your commitment to using your resources for measuring what matters for your mission.
I think we're getting toward the end of our time. I really wanted to thank you, and I cannot thank you enough. Usually when you hear people talking about social, measuring social impact or social change, we get into discussions of RCTs or SROIs. As interesting as those tools are, I think we miss the point when we focus on a tool and forget the big picture. What I really like about your approach is that you're tying it with a strategy, and the different types of strategies mandate a different way of measurement. And this actually puts it in the right perspective. So thank you. It's been very mind-opening, and I really recommend everybody to sort of get a copy of the book or the materials you've suggested. I think we've lost we've lost him, but anyway, it's been really interesting, and I thank you, and thank you all for attending. On Wednesday, we're going to have a lecture. We're going to have a webinar by Amit Kapoor. The title is Economic Development and Democratic Outcomes. I look forward to having you with us. Thank you. Bye-bye.